Welcome to IS-PEC Talks. Today's guest is Dr. Sarah Birken, a leading voice in implementation science and associate professor at the Wake Forest School of Medicine. Sarah is internationally recognized for her research on how to move evidence into practice, especially within complex health systems, and for helping us understand what actually drives successful implementation from the inside out. Her work focuses on the role of middle managers in implementation, the use of theories, models, and frameworks, and innovation in cancer care delivery. She's also a champion of building inclusive research environments and mentoring the next generation of implementation scientists. In today's conversation, we'll be exploring one of her core passions, the role of middle managers as implementation leaders, the often overlooked people who make or break the success of evidence-based interventions on the ground. So we're going to dive right in. Sarah, let's start with the big picture. What's a middle manager and why do they matter so much in this world of implementation science?
Well, that's a good question because there are many different definitions of a middle manager. There are multiple levels of middle managers. So technically, a middle manager can be anybody who is not a frontline employee and is not a top manager like a CEO or a CMO, but the people in between. So the classic example I think of that I think resonates with most people is a nurse manager, a unit leader, somebody. The important piece of the definition of a middle manager is that it's somebody who is taking strategy that's developed at the top of the organization or that emanates up from the front lines and putting that into consistent action. And that's why they're so important for implementation because in many cases, implementation is happening because there's some guideline or new initiative that needs to be put into place. And the people who are charged with enacting these policies are middle managers. So they really set the agenda in many senses.
And are they, you would assume that they're also part of the decision-making process, right? They're not only in the implementing or not always.
It depends. That's an important variable, whether or not a middle manager is part of figuring out how the strategy should be designed or enacted. And we don't really know the effect, but theoretically, having some say in what the strategy is and how it will be implemented, is a good thing.
Yes. Well, we know that from the business literature, right? That the more buy-in there is. So I assume it would translate to this as well, but what you're saying is we haven't really studied it.
No.
Okay. What's been the most surprising finding in your research in terms of the role of middle managers and how they influence the success or failure of implementing evidence-based practice?
Well, I remember in my dissertation research, which was about the role of middle managers in implementing health disparities collaboratives in the Midwestern US, um, that initial preliminary analyses showed the role of top managers in um, facilitating middle manager's role. But the final analyses really focused on performance reviews, which I don't know, I think a lot of people have been in performance reviews that don't feel all that impactful. I certainly have. But it was a mixed method study that showed that the mechanism underlying that relationship was clear, open, and regular communication. So getting back to that topic that you were talking about before and being involved in the decision-making process. So having a relationship with the top manager that facilitated kind of a dynamic approach to implementation.
Okay. So were there, did you look at all at personality traits or leadership skills or more just the role that they had?
I really just looked at the role that they have. My training is in organizational sociology and organizational theory, less organizational behavior. So I think about relationships among organizations, and my interest in middle managers stemmed from an interest in centralization versus decentralization of decision making in healthcare organizations.
Okay. So we often talk about frontline providers and top leadership, but the middle is really messy because you sometimes have to implement decisions that, as we had just mentioned, you may have not been responsible for making that decision, but you need to implement it. You may have recently been a frontline provider yourself. Um, what have you found in your research as the biggest challenge that middle managers face when tasked with making these changes happen?
Um, I I can't cite specific empirical evidence of the barriers that middle managers face, but I can just tell you from the work that I've done, in the course of doing the work that I've done, my perception is that middle managers are contending with their own feelings about the initiative that they're tasked with implementing, and may have to facilitate the implementation of something that actually they don't think is going to improve practice. So that's a tension that they have to contend with. Another one is that they may be asked to promote the implementation of something for which they're given very few resources. And so they're having to figure out how to do something on a shoestring budget or with no support at all. And a third one that comes to mind is provider resistance, or frontline employee resistance. Change is hard. And the kind of emotional, social, practical, logistical challenges of mitigating frontline employees' responses to the change seems to wear a great deal on middle managers in what I've seen.
It's the classic "don't move my cheese," right?
Exactly. Yep.
So what have you found in the research mitigates all? It is very, very stressful. Unfortunately, this isn't unique to healthcare. Maybe the last finding is because the professionals have a very strong voice in healthcare versus in other fields. Maybe it's not as strong, but what have you found may have helped the middle managers,
Yeah.
whether it's implementing something that they don't necessarily align with, or not enough resources, or resistance? Were there one or two um, initiatives that may have supported them?
So, a couple of things. One is that uh, it seems to me that it really depends on the initiative and it depends on the context, what strategies might be most effective in supporting middle managers. But I think it would be useful for me to talk very briefly about a study that I'm doing right now about um, improving sepsis care in emergency departments. So ED physician leads, ED nurse middle managers are tasked with uh, ensuring that ED providers and staff are documenting their sepsis care to facilitate reimbursement. And what I found in this research is that multidisciplinary engagement, so getting back to what we were talking about before, involving middle managers in the conversation about what's happening, but it goes further than that in the sense of bringing in the perspectives of all of the people who have some role or some stake in the change. So that's a big one. The other one is making sure that the strategies that they are allowed to apply are relevant to the behavioral mechanism of the change. So a lot is done around training of nurses about what signs and symptoms to watch for in sepsis. But the electronic health record is a bear and makes it nearly impossible for those nurses to do what the training says. So making that alignment better is certainly something that I found in this particular study facilitates their role.
Okay. So I want to pivot a little bit because, well, it's not really pivot, but you had mentioned, context and how context is important. Um, and I know this is, I think, when we first met was when you were doing your massive study on looking at the organizational factors and organizational theories. Can you talk a bit about that study?
Yeah, so I developed, along with a very large group of researchers, a framework called Organization Theory for Implementation Science, or OTIS. And the goal was to kind of bring together theories that may have relevance to implementation. And we went through an international process of surveying investigators, including you, about which theories may be most relevant, and then kind of breaking those into domains that may be instructive. And so the domains, I believe there are 6, and they relate to things like governance, tasks, learning, these sorts of things.
Okay. And where has that work gone since, I mean, it
Yeah.
was published? And I was personally fascinated by the process, which we can talk about another time, but the tools you use to get the input from all the different international experts was really amazing. But where have you taken it since then?
I'm actually applying it in that sepsis study that I was talking about. So you really can't separate what's happening within an organization from what's happening outside of it. And in the relationships that organization has with others. So all of what's happening in emergency departments and the hospitals that govern them is dictated in large part by accreditation standards and reimbursement policy and the hospital's position in health systems that it may be a part of. And it's grappling with all of these dynamics and understanding the I like to think about organizations like humans who, sure, our biology is really important. What's happening inside of us is really important, but we know it's incredibly important whom we socialize with, what our physical environment is like, what our community is like, what the character is of that community. And that is absolutely the same as healthcare organizations. Um, and so I'm using the Otis framework to inform understanding the mechanisms that drive what's happening around efforts to improve sepsis care. So that's one example. I know that there are other applications of the framework out there, but I found it super interesting and an opportunity to really dig into the multi-level influences on implementation.
And we will link to the article in the podcast notes. Um, so two final questions in terms of, for future generations, because we have a lot of students that listen to these podcasts. So what advice would you give to researchers who want to better engage middle managers in their implementation efforts?
Oh, well, at the risk of being controversial, um, I'll
We
begin
love
by
controversy.
okay.
We love it.
I'll say, before I say the controversial thing, I'll say multiple approaches will be important. Um, and an uncontroversial thing that I'll say is just being mindful that these people are extraordinarily busy. They have very little time. In my experience doing research, in the vast majority of cases, their work is a passion for them, and they're doing this not for the money or the fame or the glory. They're doing this because they're good at what they do. They want to help. The controversial thing is that in healthcare, which I've found to be quite hierarchical, um, top managers' willingness to um, give the researcher entree into engaging with the middle manager is important. I hate that top-down approach, but I've had many middle managers tell me point blank, you're going to have my boss tell me that I'm allowed to do this. And sure enough, is if I can get the top manager to say, go ahead and engage with this researcher, they've been more amenable because they know it's a sanctioned use of their time.
Right.
Yeah. And
But it's
appropriate
understandable.
compensation too. I'd say appropriate compensation.
Right. But it's understandable that they would want, meaning we know healthcare workers are stretched to the brim, right? So if they're
Yes.
going to allocate time to a project, that means they're not going to be allocating time to something else. So
That's
they
right.
would need their managers to, but yes, it's very bureaucratic.
It is. Yeah.
Um, okay, what's one thing you wish every health system leader understood about how change really happens inside their complex organizations?
Oh my gosh. Um, I think there's some magical thinking among healthcare leaders about the way change happens, and that if they think it, it happens, or that if they want it to happen and they give instructions, um, that people will just fall in line. And they're not thinking about, again, getting back to the Otis framework, about the complex systems that really dictate whether change can happen at all. So, and a lot of time, leaders are thinking about individual behavioral determinants rather than thinking about the much bigger levers of organizational change. So, thinking about um, the information technology systems that may present barriers, thinking about the policies that conflict, that prevent something from being implemented. And for lack of a better word, the vibes. There are some people in organizations that are incredibly influential in any number of directions, but I've seen very well crafted implementation efforts brought down by a single um, sour grape, let's say.
Yeah, no, that's definitely true. I think we all have those experiences, and they're more frequent than we would have anticipated.
Yeah.
Mhm. But we're about to end, and we don't want to end on a down note. So let's end on a positive note. Um, tell me something, give me some nugget that really surprised you throughout your research journey, positively.
Yeah. And most of my kind of surprises have been positive. I, although change is incredibly difficult in healthcare organizations, and sometimes it feels like everything is pitted against driving really fundamental change. Um, I've been so pleased to find out that every individual I've met fundamentally wants to do good. Um, it can be very difficult in the face of systems that, for a variety of reasons, don't allow them to do what they would really prefer to be doing. But at the bottom of it, I really haven't encountered anybody who wanted anything other than to help people, and that's really nice.
Right. I think that's true for many different issues in society, not just here, but people ultimately, they want to do good, they want to do their best. They're just overwhelmed and overworked, and we need
That's
to make it
exactly
easy
right.
for them. Yeah.
Yes. Yeah.
Okay, Sarah, thank you for your time. I really appreciate it. I know how busy you are, and maybe we'll follow up in a future podcast.
Thank you
Thank
so
you.
much for having me.